Good evening, everybody. Thank you for joining our webinar tonight, Getting to the Heart of Mental Health, presented by the Odayin Diversity Council. We're really excited that you are here. I can't wait to introduce you to our three fabulous presenters. Before we do that, I'd love to do a quick introduction of the Camp Odayin team. My name is Sarah Meslow. I'm the Executive Director at Camp Odayin.
Hi, I'm Chris Lucarilla. I'm the Director of Operations.
Hi, everyone. I'm Matt. I'm the Finance Director for Camp Odayin.
Hello, friends. I'm Allison Berner, and I am the Assistant Director.
Hey, everybody. I'm Aiden. I'm the Marketing and Program Director for Camp Odayin.
Hey, y'all. I'm Brooke. I am the Program Director. A few housekeeping items before I turn it back over to Sarah to introduce our stellar speakers tonight. We are using the webinar format of Zoom tonight, so your camera and microphone are disabled. We are using the Q&A feature as well, not the chat box. So feel free to type in any questions you have for our presenters. They'll answer the questions at the end of the presentation tonight. The last thing, this webinar is recorded and posted on the Camp Odayin YouTube channel for sharing. And finally, we acknowledge that our partner camps in Minnesota and Wisconsin and the office in Minnesota are on the stolen and traditional lands of the indigenous peoples who are the original stewards of these lands. With honor, we acknowledge the use of this land in the Ojibwa language. May our hearts and actions be full of respect and gratitude for this land and its history. All right, off to you, Sarah.
Thank you, Brooke. I have the honor of introducing our three presenters tonight. We have Nadine Kasparian, who is the Director of the Heart and Mind Wellbeing Center at Cincinnati Children's Hospital. We have Dr. Erica Sood, the Director of the Nemours Cardiac Learning and Early Development Program at Nemours Children's Health in Delaware. And we have Kate Allman-Shade, who is the Director of Education at the Cardiac Neurodevelopmental Program at Boston Children's Hospital. We're going to hand it over to Nadine and Erica to kick us off. Thank you.
Thank you so much, Sarah. Let me just share screen and get us set up. Can you see that okay, Sarah?
Yes, I can. Thank you.
Thank you. Thank you so much for the warm welcome. We are honored to be with you this evening and to be partnering with Camp Odayin to celebrate and also shine a light on Mental Health Awareness Month. So this evening, Dr. Sood and I will provide an overview of mental health and the ways pediatric and congenital heart disease can affect mental health and well-being. We'll also provide tips to promote well-being, as well as a range of different supports and resources, really emphasizing that there's no one size fits all when it comes to mental health care and support. But first, I'd like to start by sharing a story about a patient that our team at Cincinnati Children's met recently. Alice had a VSD, or ventricular septal defect, repaired surgically at age 6 in 1957. And she's now 72 years old. Our adult congenital heart disease team met Alice only recently because she had been lost to follow-up cardiac care. By all accounts, Alice led a pretty normal life. She had gotten married, enjoyed her work and family life in Cincinnati, and had recently retired. But a few months ago, she was referred to a community-based cardiologist to assess for coronary blockages. After meeting her, the cardiologist became concerned Alice may have pulmonary hypertension and connected her with our ACHD team. The team quickly realized Alice's elevated right ventricular pressure was not due to pulmonary hypertension. Instead, they noticed something else that could cause high pressures, a hypertrophic muscle causing mild obstruction. And the team figured this would put Alice's mind at ease, but that isn't what happened. During her visit, Alice became tearful and was shaking. As they listened, it became clear she carried an enormous post-traumatic burden. Alice had been living with anxiety for years. She had vivid memories of past medical experiences and worried intensely about her health. She avoided healthcare and had great difficulty even walking into the hospital. During medical visits, her mind would often go blank and she rarely remembered what doctors told her. The cardiologist who referred Alice to our ACHD program, a really kind and caring doctor, had no sense of her PTSD, really highlighting how under-recognized and undertreated these conditions often are. And the ability to quickly connect Alice with a psychologist who has expertise in congenital heart disease, who works side by side with our cardiac care team, allowed her to have the medical care she needed and also to start living with her heart disease rather than in fear of it. Now, this photo is from our archives and was taken in 1959 at a reunion of children who had open heart surgery at Cincinnati Children's. We're yet to ask Alice if she's in this photo, but we suspect that she is. But what we do know is that she recently celebrated her 72nd birthday by going on an Alaskan cruise, and she had an absolutely wonderful time. Since Alice's heart operation in 1957, we have come a very long way in terms of our understanding of the experiences of children with heart disease. Now, I think we would all say that even if psychological distress had zero impact on health outcomes, this would warrant attention and treatment in and of itself. But we know that psychological factors not only affect our mental health, they can also affect a person's physical health, their capacity to partner with their heart care team on treatment recommendations, their relationships with family and friends, their sense of satisfaction with life, and interactions with the healthcare system. And overall, research shows that psychological well-being is one of the strongest predictors of quality of life among children and adults with congenital heart disease. Last year, the American Heart Association published its first scientific statement on congenital heart disease and psychological health. And this statement was written by a multidisciplinary group, including pediatric and adult psychologists and psychiatrists, social worker and pediatric and ACHD cardiologists, a nurse practitioner, and most importantly, people with congenital heart disease. And together we emphasized the importance of access to mental health care for people of all ages and stages with congenital heart disease. But what do we mean when we talk about mental health? Well, the World Health Organization defines mental health as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is more than the absence of mental disorders. It exists on a continuum, which is experienced differently from one person to the next, with varying degrees of difficulty and distress, and potentially very different social and clinical outcomes. And access to mental health care is recognized by the World Health Organization as a basic human right. Now, when faced with challenges, there are many factors that can influence mental health across our lives. And we know that no two people have the same experience, which is why when we want to know how someone is doing, we really need to ask them directly. And in addition to the challenges that we all face, there are many factors, both positive and negative, that can affect mental health and well-being throughout life for people with congenital heart disease. And these may begin as early as in the prenatal period after fetal diagnosis of CHD and can extend or begin in infancy, childhood, adolescence, and adulthood. A few years ago, we analysed data from 44 studies exploring the experiences of over 1,000 children and young people with heart disease. And these children and young people were between the ages of 6 and 21 years old, and they came from 12 different countries. And overall, they identified 6 key factors that they felt influenced their mental health and well-being. And these were disruptions to normal life, such as hospital admissions, surgeries and other procedures, medical visits, coping with medications, and the onset of new or worsening cardiac symptoms. Feeling powerless during periods of illness, especially when complications arise or advanced cardiac therapies are needed. Ongoing health uncertainty and adversity, including memories of health experiences or hospital encounters that can persist for years. Feeling at war with the body, including frustration in response to fatigue or physical symptoms and body image concerns. And hampered goals that may be associated with worry and overprotection from others, neurodevelopmental delay or disability, educational or occupational challenges, and feeling different from one's friends and siblings. But alongside these challenges, in our study, many children and young people also described tremendous resilience, finding ways to establish their own pace, foster hope and a determination to thrive, to embrace the positives, and to value empathy and supportive relationships. And when writing our scientific statement, we felt it was incredibly important to not only raise awareness of the challenges experienced by people with CHD, but also the many strengths that we see every day in our clinical practice and in our research. And these include learning to manage during times of uncertainty, being able to adapt and be resilient in the face of new and confronting or difficult situations, having a great sense of humor and a capacity to bring a sense of lightness when times are tough, being creative and artistic, and being kind and empathic, being a good listener and a good observer, being able to tap into gratitude, and having a deeper sense of what is truly meaningful and important in life. And now I'll hand over to Dr. Sood.
Thank you. So we've already heard quite a bit about mental health. I'm just going to talk a bit more about what we think about when we think about mental health as psychologists. When we think about mental health, we think a lot about thoughts. So what thoughts do people have much of the time? We think about feelings. Feelings are a normal part of everybody's experiences, and people can have positive feelings as well as some challenging feelings. We also think about behaviors or actions. Next slide. So, to give you an example of the kinds of thoughts that people might have that, that may make things more challenging for them. Thoughts like, it's all my fault, or I'll never get through this, or what if. There are some people that experience a lot of what if thoughts, and those can spiral. What if this goes wrong? What if this happens? And these are the types of thoughts that as psychologists and mental health professionals, we often ask about, how often do you have thoughts like that? And how difficult are those thoughts to control? We also ask about feelings like anxiety, feeling overwhelmed, being frequently irritable. And we think a lot about behaviors. So what types of behaviors are people engaging in when they're having these thoughts or feelings? Are they avoiding due to anxiety? Are they avoiding making doctor's appointments? Are they avoiding going to school or getting together with friends? Are they isolating? Do they feel like nobody kind of can understand what they're going through, and so they're actually separating themselves from their peers? And are they lashing out? Next slide. when we think about mental health concerns, they're on a spectrum. And this is really important to keep in mind because there's a wide range of what we think about as normal. So just because somebody has one of those thoughts, on occasion, I think we all do, that doesn't mean that that person has, a mental health condition. It means that they're human. And so, as psychologists, I think if anything, we tend to normalize and say, that really sounds like it's kind of within the realm of what we would expect. There is a range of what we would consider to be at risk, and that would be thoughts, feelings, behaviors that may be uncomfortable, maybe more frequent than we would expect, but aren't causing significant challenges. So for example, the child, or the adult is still functioning well at school or at work. They, are still functioning well at home, socially. It's not causing big problems for them. It's, the mental health challenges that they may have are manageable. And in those cases, we'll often say, keep an eye on it. Let's be proactive and try to prevent these challenges from becoming a problem and starting to interfere. And then there's that diagnosis, which is really oftentimes just like the top 5% or so. And so those are when these normal or common thoughts, feelings, and behaviors are really starting to cause problems for the individual or for the family. It's starting to cause problems in school or at work. It's starting to cause problems at home. And as psychologists, we often think a lot about what we call impairment or distress. So we may have these thoughts or feelings or behaviors, but if it's not causing significant impairment, that's not considered, in most cases, a mental health diagnosis. But it doesn't mean that we don't still want to address it or be proactive. Next slide. So, as we heard a bit about already, mental health concerns can be common in children with congenital heart disease and their family members. One recent study showed that children and adolescents with congenital heart disease have about a 5 to 7 degree higher rate of anxiety, depression, behavioral problems, and ADHD in one population-based study. Other studies have found that about 25 to 30% of children and adolescents with CHD have some degree of PTSD symptoms. Now, that doesn't mean that they meet criteria for post-traumatic stress disorder, but it does mean they might experience some intrusive thoughts, thoughts or images of stressful medical experiences that they really don't want to have and are kind of popping into their minds at times when they're not wanting to be thinking about that. They may have physical reactions when they go to the doctor's office. Their heart might start pounding. They might start getting sweaty or shaky. Their heart, is racing. Or they may be avoidant. There's certain behaviors that they may avoid because of the anxiety and traumatic stress related to these medical experiences. And across studies, about 30% of parents of children with CHD have clinically significant mental health challenges at a single point in time. Most studies of mental health in the congenital heart disease population really look at a snapshot in time. There are not too many studies that are looking, over a long period of time. And so a lot of what we know is really at one snapshot in time, what are we seeing in terms of mental health concerns? And across time periods, across studies, if you could generalize it, I would say, 30% seems to be pretty common. Next slide. So we already heard a bit about this. Why are children with CHD at increased risk? And Dr. Kasparian already mentioned that, medical experiences can be scary and even traumatic. They can feel unpredictable and not within their control. Neurodevelopmental challenges are common, and these can, make life just a little bit harder, make it a little bit harder to feel good about schoolwork or how they're functioning with peers, which can sometimes lead to some anxiety or sadness. Kids can have difficulties regulating emotions and behaviors. They tend to miss school or social opportunities if they have hospitalizations or doctor's appointments, and they may feel different. Next slide. Parents and caregivers, there's a lot of work being done on understanding the experiences of parents of children with heart conditions and how we can help parents to be able to kind of cope with these difficult experiences. And we know that parents do experience, potentially traumatic experiences related to their child's congenital heart disease. And, these experiences are often chronic in nature. So it's not like, if you think about someone gets into a car accident and they consider that to be a trauma, they're having some traumatic stress symptoms, it's not likely that their doctor is going to say, well, getting into a car accident is a lifelong condition, it's going to happen over and over again. And so I think, having a diagnosis like congenital heart disease that does require lifelong medical care, requires, continuous medical appointments, and in some cases, multiple procedures or surgeries or hospitalizations, does make that kind of part of post-traumatic stress a little bit difficult to assess and determine kind of when is post, because oftentimes it's really more a chronic state of, waiting for that other shoe to drop. Parents often feel that, this diagnosis and their experiences are unpredictable. So they're not entirely within their control. They're not often choosing to have their child go into the hospital or need to have heart surgery. There's a lot of day-to-day parenting stress, things like managing feeding tubes, managing developmental appointments, early intervention, a lot of medical appointments, having to miss work. And then there could be strain on relationships. And sometimes parents do feel isolated or alone and feel like people around them don't entirely understand, their experiences. Next slide. It's important to think about the experience of siblings as well. We know that a diagnosis of congenital heart disease can shift family dynamics, especially for a period of time if the child's in the hospital or is, having frequent medical appointments, or there's a lot of concern about the child's health. And this, of course, can affect the siblings as well. Siblings sometimes worry about their sibling with CHD, or they worry about their parents in terms of how their parents are coping. There's, in some cases, long separations from parents during hospitalization, and sometimes siblings, whether they kind of overtly recognize it or not, can try not to add stress to the family, especially who's already, going through a lot of stress. It's important to remember that when we think about parent mental health, that it's not just about the parent. The parent is very important, and parent mental health is important in itself, of course. But it also can affect the whole family, and it can affect the child. We know that there's a large body of research showing that mental health in a parent does affect parenting and can affect children in the long term. And when somebody is experiencing, let's say, traumatic stress reactions, they may be more overprotective in their parenting style. So not necessarily, giving their child the same opportunities as they might if they were not experiencing those mental health difficulties. They might have difficulty setting limits because, it's hard. You can't control the things that your child's going through. And so it can be hard to say no to a child who's in the hospital or having to go back, for medical appointments, or when you feel like, they already feel different. It can be difficult when you're experiencing mental health challenges to be present in the moment. And sometimes there's reduced patience. And then we also know that mental health can affect family relationships. And so when we think about mental health, we really have to think about the mental health of the family, not just the patient with CHD, but also their parents, their siblings, and the family as a whole. Next slide. So I'm going to switch gears to talk a bit about some tips to promote mental health and well-being. So I think, one of the most important things is really to normalize the emotional impact of CHD. It is normal to have thoughts and feelings about the stressful things that we're going through. That's normal. Everybody has that. And when you have CHD, or you have a child with CHD or a sibling with CHD is going to affect how people think and feel and behave. And so, when we're talking to kids, when you're talking to your partner, when you're talking to, anyone in your family or, to yourself, normalizing the emotional aspects of CHD, that if you feel like CHD has affected how you feel or has affected your child, that's normal and expected. It's a big stressor. When you're talking to family members, asking open-ended questions, trying not to just cheer someone up, but, because it can be hard to see your child upset, right? And it's easy to say, like, but think of all the good things, right? Or, stop being upset or try, let's think about something else. And sometimes we just need to kind of listen and validate and hear what they have to say and listen to their experiences, and really try to understand the lived experiences of patients with CHD, of their families, of your partner. you know, I think it can sometimes be easy to say like, yes, I know this is hard, but let's look on the bright side. Let's think of all the good things we have. And I think sometimes you can replace that with and that can have a huge impact. So yes, you know, I know this is hard, and I know that you can get through this, right? And so just by replacing a but with an and kind of communicates that both of these things are true, and you're not discounting how they feel by also pointing out some of the positives. Seeking mental health support proactively. I know this is really difficult when there's such a shortage of mental health supports, but it is important to start to look for those resources earlier rather than later. You know, if you hear that a place has a 6-month wait list, well, it's better to get on that 6-month wait list when it's not a crisis and there's not this kind of time limit on when you need to get in. You know, if your child is in a situation or you're in a situation where you really need mental health support now, it can be really hard to be told that, sorry, we don't have any space right now, or, you know, you have to wait. And then share your story. You know, there's a number of good reasons of why sharing your story is important for well-being. Number one, by sharing your story, you know, you recognize in many cases that you're not alone, and that what you're going through is something that many other families have gone through as well. It also can be helpful for other people to hear your story. Next slide. Self-care. So, you know, I know we hear a lot about self-care, and sometimes it can be, it's a lot easier said than done. But there are, you know, basic things that are important for everyone to do, regardless of whether you have a child with CHD or a patient with CHD, just for our general well-being. And one of those is sleep. You know, just doing our best to try to keep a consistently sleep routine can really, you know, be important for our mental health and well-being. Staying active, you know, trying to, even in stressful times, going out for a walk, getting fresh air. Sometimes, you know, the more stressful and more busy you are, the more important it is to do that. Using relaxation techniques, you know, there are so many resources online. There's apps. Some of them you do have to pay for, some of them are free, where you can find, you know, something that works for you. And it's not one size fits all. So there's all different types of, you know, breathing exercises and mindfulness and meditation, and you have to find one that works for you. Plan enjoyable activities. Again, it can be really hard to do this in times of stress, but that's actually when it's most important to find some moment of joy in your day. And maybe it's, you know, 5 minutes, and that's okay. 5 minutes is a whole lot better than 0 minutes. But something that you do, or, you know, that you encourage your child to do every day that is, that kind of helps you to recharge, and gives you, you know, a moment of peace or a moment of calm. Focusing on strengths, you know, and what one can do, again, not without discounting the feelings that people have. So, you know, if your child says, yeah, I can't do anything, to kind of acknowledge how they're feeling and normalize that, and validate that. And then also, you know, and I know that we'll find something that you can do that you do enjoy. Self-talk. So it can be a whole lot easier to engage in negative self-talk than positive self-talk. But we're really good as like friends and family members at using that positive self-talk on other people. So if you're having a hard time sort of saying positive things to yourself, think about what would you say to a good friend in this situation? If a good friend was struggling with, you know, whatever it is that you're struggling with, or your child's struggling with, you know, what would you say to them, and see if you can kind of turn that on yourself. Next slide. Seeking support. There are many different options for peer-to-peer support in the congenital heart disease community. There are local support groups. There are local organizations that provide peer support. There are local chapters of national organizations like Conquering CHD and Men with Little Hearts. There are online supports, so things like Facebook and other social media outlets. There are, you know, supports potentially available through friends and family and community members and religious leaders. And also thinking about helping yourself by helping others. So oftentimes, you know, people will, you know, want to give back and realize that when they do that and they do help others, it's actually kind of a step towards healing themselves. And so, you know, keeping in mind, and obviously that has to be when you're ready, or when your child's ready, that, you know, your child is not going to be able to be forced into that. But when they feel ready, or when you feel ready, to think about, you know, how you can give back. and how that might be beneficial, not only to the person that you're giving to, but also for yourself. Obviously, Heart Camp, this is a group that is part of, a community, and CHD events like heart walks, other types of fundraisers for CHD. These are all ways that you can meet other people going through similar experiences, and give back. Next slide. So recognizing signs and symptoms. Even if your child, your partner, the other kids are not experiencing mental health challenges right now, it's good to know about, what to look for and when to maybe seek support. Nemours Kids Health is a great resource that has lots and lots of articles and information about all different kinds of conditions. And that does include kind of mental health conditions, as well as sort of some social challenges like bullying. There's a site for parents, there's a site for teens, there's a site for kids. The Heart and Mind Wellbeing Center at Cincinnati Children's has resources online that are specific to heart conditions. EffectiveChildTherapy.org was put together by an organization of psychologists, and it is a great website, and it goes into detail on different mental health conditions that can affect kids. That's specific for children, but really good information about sort of what are the signs and symptoms, what is anxiety in kids, what is depression in children. WorryWiseKids.org is another one. This one is focused primarily on worry and anxiety, but goes into a lot of detail about what different anxiety conditions look like, what to look out for, different resources that might be available. There is a free assessment center from an organization called Helping Give Away Psychological Science. There are other assessment centers. This is the one that I'm aware of. I can't speak to others, but this one it just provides resources for people who want to just kind of take a screener and assessment online, and it will send you the results and some recommendations specific to the responses that you put in there. And that's, it doesn't replace seeing a mental health professional, but it's free, it's online, and it's something that just can help you in understanding, are the symptoms that I'm experiencing, or my partner, or my kids, is this something that we need to be concerned about? Conquering CHD, which is a CHD organization, on their website, there's a resource called Promoting Mental Health for Parents of Children with Cardiac Conditions. And this was something that myself and another psychologist put together several years ago. And it has a table that has kind of common signs and symptoms that are kind of specific to, the things that parents of children with heart conditions may go through related to anxiety or related to depression or traumatic stress. And so kind of scanning that table and saying, are any of these things that I've experienced, or, my partner's experienced? Next slide. Talk to your doctors and nurses, your primary care doctor, your child's primary care doctor, your child's cardiologist, or your cardiologist if you're a patient. Let them know, what your experiences have been like. If you are struggling, let them know. They won't know unless you tell them. Ask to meet with a social worker or a psychologist. Many cardiac centers now have psychology and social work embedded within the center. And if they don't, the more that they hear that question, the more likely they're going to realize that, hey, this might be something that we need. Many cardiac centers have cardiac neurodevelopmental programs. So these are programs that are specifically focused on assessing and monitoring development for children with heart conditions, and often do include kind of social and emotional and behavioral assessment as well. And so these types of appointments not only will assess your child's development, but also other aspects of your child's functioning that may be relevant to mental health. And there's a list of, I would not say this is every cardiac neurodevelopment program, but if you go to the website, cardiacneuro.org, you'll see many of the programs that are part of an organization called the Cardiac Neurodevelopmental Outcome Collaborative, and with contact information for those programs. Next slide. So it can be hard to know how to start this conversation, with a member of the care team. And so some things that you can ask, is there someone I can talk to about how I'm feeling? Or do you have a mental health professional on the team? Can you help me find or refer me to a mental health professional? Does your program have a peer support group? Can you refer me to a patient support organization? Do you have any other resources for mental health? These are the types of questions that, that you can ask. It is okay to ask these questions. And it's actually important because the more that the medical practice or the hospital hears these questions from patients, the more they realize, like, this is actually a priority, right? This is something that our patients and our families are asking for. Nobody likes to say no to these types of questions. And the more that people kind of communicate that these are things that we need as patients or as families, the more likely it is that centers will invest in this. Next slide. Learning about evidence-based therapy. So if you or your child are having challenges, it's important to know, what therapies have been shown to be effective. There's a lot of different types of therapy out there. Not all of them have been shown to work. And so that site that I mentioned before, effectivechildtherapy.org, again, this is specific to kids, but they go into all the different types of treatments for kids that have been found to be effective and some of the, research behind them. Learning about services offered through the care center, I mentioned that before, calling your insurance company for a list of providers, and then asking about telehealth options. So obviously, since the pandemic, there have been more and more, opportunities to receive therapy from home, which doesn't work for everybody. It's not something that everybody, finds to be helpful or would prefer. But for many people, it is. It makes mental health services much more accessible. Other options, many universities have psychology training clinics. So any university that has a doctoral program in psychology is likely to have their own internal training clinic. That means that the therapy is provided by doctoral students. So it would usually be like second, third year doctoral students. So they're supervised under licensed psychologists. They're well trained, and they often offer much reduced costs and sliding scale fees. So that's just an option, to look into. Employee assistance programs, many jobs will have programs where you can access a certain number of therapy sessions, at no cost as part of the kind of employee benefits. And then, thinking about clinical research studies. Now, there are many different types of research studies. There are some research studies that are comparing one treatment or therapy that has already been found to be effective to another treatment or therapy that's been found to be effective, and they want to understand, what's best, right? Is it better to do this? Is it better to do that? Or a combination of two? And so those are studies where these are already treatments that you could get out in the community, but instead, if you enroll in a research study and you fill out questionnaires and you kind of agree to be part of that study, that you may be able to receive a treatment through that study. There are other studies where the treatment that they're testing is not kind of considered evidence-based, meaning that they're doing the study to see if it works, but they often have preliminary kind of information that says this might be effective, and we want to figure that out. So, you want to understand what the therapy is that you're going into, but this is just something to keep in mind. And there's some clinics, often set in universities where they primarily function as a clinical research site, but they also provide sliding scale therapy. So these are just things to think about when you're looking for kind of thinking outside the box and how to access resources. There are a lot of online resources as well. There's a program called P Positive Parenting Program, which you can access kind of parenting resources online. Incredible Years has local groups on parenting difficult behaviors, and online resources as well. There's online resources for kids and also parents for child anxiety. And then healthcaretoolbox.org is a website that has a lot of resources related to traumatic stress in children, and parents. So, the types of challenges that people can have when they go through difficult medical experiences. These resources are targeted towards children with medical conditions or illnesses, and their parents and their healthcare providers. Next slide. Consider periodic check-ins with a mental health professional or booster sessions, even when there are no major concerns. Just keep up that relationship, because then you can go to when there is a challenge, and use mental health supports in a proactive and preventative manner. So, just to kind of leave with a vision for the future, and I think that I would imagine that Dr. Kasparian shares this vision as well, that, we feel that all children with CHD and their family members should have access to mental health services, and particularly as a preventative service, as well as treatment for when people do have significant challenges, and that every pediatric cardiac center should have a dedicated mental health professional, and really not just one, but multiple, to serve the needs of the community. And so encourage everybody, just share your story, talk to your care team, let them know that this is something that's needed, and let, others know that they're not alone if they're having mental health challenges. And I think, as a community, with professionals, patients, families, we can work together to make this happen. Next slide. And we wanted to leave you with the QR code for a piece that was developed specifically for patients and families around that scientific statement that Dr. Kasparian had talked about on the psychological aspects of congenital heart disease. And this is specifically information on that article for patients and families. Thank you so much for inviting us to speak.
Thank you, Erica and Nadine. That was great. Hold on, let me just get my screen. Okay, can everyone see this? Does this look good? Okay, great. So, so that was great. So, such a nice background in terms of the types of psychological challenges that we can sometimes see in young people with congenital heart disease. I'm going to narrow the focus a little bit. So Nadine and Erica were talking really broadly about congenital heart disease and all the challenges that we can see in the mental health world. And I want to talk specifically about school and learning, since, as we know, our kids for 13 years usually spend an enormous amount of their waking hours in school. And so we can provide, the best possible care at home, but if we don't have an appropriate school environment that's going to support their mental health, there's still going to be a problem. So it's talking about mental health and learning in children with CHD. So these are going to be topics. So first is broadly talking about mental health. I'll breeze through that because we've got a great introduction, how it can affect learning, and then talking about different levels of support we can offer kids at school, starting from kind of least intensive to most intensive. So accommodations, services, and then placements, and then talking about how you can advocate for your kid. And don't worry, there'll be time for questions. I'm going to go through this pretty quickly. So first, as you just heard, we know that young people with congenital heart disease are at much higher risk of mental health disorders than their peers who don't have congenital heart disease. So especially things like anxiety, depression, post-traumatic stress, and attention deficit hyperactivity disorder. And then also there are certain subpopulations of the congenital heart disease community who might also be at risk for different mental health challenges. So for example, in 22q11 deletion syndrome, which is associated with congenital heart disease, young people are at a high risk of early onset psychosis. And there's some other genetic disorders that also carry with them a risk of certain psychological challenges. And whenever there's a mental health problem, there's usually an interaction with learning. So first of all, we know that mental health problems and learning disabilities can occur together, and actually often occur together. And if a child has a diagnosis of a learning disability, they are more likely to have a mental health problem. And conversely, if a child has a mental health diagnosis, they're more likely to have a learning disability. But even when a child doesn't have a specific learning disability, their mental health can still interact with their learning and their school experiences. So you can imagine if there's a young person who has anxiety or depression or severe ADHD, they may struggle with things like poor attention. They may be missing instructional time if they're out of the classroom or if they're not attending to the classroom instruction. They may be struggling with motivation. They may be engaging in behaviors that interfere with their ability to to engage with school or engage well with their peers. They might have reduced social skills, and all of that's going to affect how they learn. And then conversely, the school environment is going to affect their mental health. So you can think of factors in a school, like, a child is being measured. So they might be afraid of not performing well, afraid of failure. They're interacting in a complex social environment that they may or may not be able to navigate well. And even if they can navigate it well, there's always going to be kids who, may be mean or hurtful. They're getting grades and feedback, which can feel good or not good, depending on the child. Maybe the subject of disciplinary actions. There's often in schools sort of an expectation of a level of uniformity and obedience that may be really tricky for some kids. And then there's, schools tend to be these really intense sensory environments that may be uncomfortable or upsetting to many kids. And so you can think of how the school environment may then affect mental health. So for some kids, this is a great feedback loop. They're doing great on both sides. But for a lot of kids, and for more kids with CHD than kids who do not have CHD, there's challenges in both these arenas that inform each other and interact with each other. What that means also is that school is a good point of intervention in terms of supporting kids' mental health. So how we can help, so as I'm sure you know, children with disabilities have the right to fully access the curriculum and to make meaningful progress appropriate to their ability. And those are very deliberately chosen words because that's really what the two relevant laws explicitly provide for. So there's two different types of programs, educational programs that a child may have a right to, depending on their needs, that can help them if they have a mental health disorder. So a 504 plan would be from the Section 504 of the Rehabilitation Act. And 504 plans are all about guaranteeing equal access to instruction. So you can think of it as like, a ramp for a wheelchair, which can absolutely be in a 504 plan, but it's also all the figurative ramps for a wheelchair. It's ways to allow the child to receive equal instruction. 504 plans, generally include accommodations and sometimes some services. And then an IEP, which is also special education, comes from IDEA, so the Individuals with Disabilities Education Act. And this guarantees meaningful progress appropriate to ability. So you can see it's a little bit more stringent than a 504 plan, which is just equal access. And an IEP can provide a child with a placement, an educational placement, services, and accommodations. And there's a little more to each that we're not going to go into. So then I'm going to go over each type of support a child may have a right to, starting from sort of the least intensive to the most intensive. So at the sort of the front line is school accommodations, which can compensate for mental health, help a child compensate. And this can be provided through either an IEP or a 504, or sometimes just a behavioral plan or an accommodation plan in the school, or it can just be informally implemented by a teacher. So you can think about lots of different ways that a teacher could accommodate a child's mental health needs to help them still learn effectively. These are just some of the ones that might be relevant for some of these diagnoses. So for example, a child who is inattentive might need like frequent check-ins from the teacher. Hey, so can you tell me what we're doing? How's it going so far? Priority seating, like usually near the point of instruction. So near the teacher or wherever the instruction is coming from. A child who has hyperactivity might require more movement breaks, or, seating maybe in like where there's like a visual barrier from the other children, or access to fidget toys. Child who's anxiety might need a predictable schedule, and maybe it's provided in the morning and previewing every morning what's going to happen that day. Maybe telling a kid ahead of time if there's going to be something unexpected, like a fire drill, avoiding like high stimulation environments. And if a child has depression, maybe a focus on the quality of their work, not the quantity of their work. So demonstrating that they've learned it, but not necessarily having to do, 50 math problems. Opportunities for breaks and opportunities for for, retaking assignments without penalty. There's plenty more accommodations you could have in each of these categories, and a lot of them might work for more than one diagnosis. So next would be school services. And these are usually provided through an IEP, might be provided through a 504, or in some schools are just provided to the general education population. And these would give kids equal access and the opportunity to make meaningful progress. And so, probably the most common services you might be getting in your school would be scheduled counseling sessions. So if your child is really struggling, they can be written right into the document that they can meet with the counselor, twice a week for 30 minutes. And then also they could often have on-demand access to a counselor. So if, he's feeling really stressed in math class, he can, I say, I need to step out and go see the counselor for that period of time. Sometimes kids have a shared or a one-to-one aide who can help them to manage in classes, and help them take breaks, or, calm down or self-regulate as needed. Sometimes young people benefit from more intensive behavioral support from a BCBA, which is a board certified behavior analyst, and who can, create behavior plans and help supervise people who can help monitor the child's behavior. And then sometimes kids need access to a quieter, a separate room that they can go to when they're overwhelmed. That'll look really different from school to school, but maybe there's a room where kids with medical complexity can receive instruction. Maybe there's a counselor's room, but some sort of separate space where a child can go to and kind of calm down and self-regulate. And then sometimes if a child is not able to, achieve their potential at school, even with accommodations and special services, they're going to require a special placement, educational placement. This is pretty much always done through an IEP. And this special placement might be for some or all of the school day. And it would be in order to help the child make meaningful progress and or to remain safe. And remembering here that every child has a right to instruction in the least restrictive environment in which they can make adequate progress. So they would only be appropriate to consider a separate educational placement if the child is unable to make meaningful progress in a less restrictive environment. Or, of course, as a parent, you can always pay for a private placement if you think it's in the best interest of your child. So what a placement, a special education placement might look like for a child with a mental health disability could be something like a therapeutic classroom within a public school that's for children with social emotional challenges. Sometimes a learning disability classroom within a public school can be a more supportive environment for a child who has both a learning disability and a mental health diagnosis. Some districts have collaborative public therapeutic schools where maybe several towns together have a single school that's therapeutic and is meant for children with mental health disorders. And then, of course, there's private therapeutic schools, which may be paid for by the district, paid for by the parent. And those could be either day schools, or sometimes children require residential placement, and they do better with a residential placement. And in any of these sort of therapeutic placements, the good ones are going to be safe. They're going to be informed by an understanding of trauma, and also academically rigorous. There's usually one benefit is very low teacher-student ratios, where maybe 1-to-1 or even more adults, trained special education teachers, psychologists, and behavior specialists at the ready and in the direct care of every child. So in terms of how you can actually advocate for your child. So if you think your child needs these sorts of mental health supports at school and you don't have a 504 or an IEP, you can write a letter to the school requesting an eligibility evaluation. And in that letter, kind of, explain any physical or mental health concerns the child has, if they have a learning disability. In preparation for this, get evidence from the doctors, any outside evaluations, documenting a disability. And then, they'll do an evaluation, and then there'll be an initial meeting. And I'd always recommend considering bringing an advocate to your meeting. And then once you get, they'll decide if you're eligible or not. And if they are, they'll provide you with a draft plan, and then you can accept or reject each element of the plan in parts. And it can be after the meeting. If you have an IEP or a 504, but you think that it's not really fully serving your child's needs, what you can do is write a letter asking to reconvene your team. And then, again, bring any new data, and then ask the school to provide objective evidence that the child is meeting their goals and that the goals are consistent with your child's ability. And if you're concerned about mental health, there should be a mental health or a social emotional functioning goal, and the school should be able to show whether or not and how well the child is progressing towards that goal. If there's areas that you're concerned about, you can ask for further evaluation in those areas of concern. If you feel the school has assessed your child in an area but hasn't done an adequate job, or you disagree with the assessment, you can ask for the school to pay for a private reevaluation. I know we're in multiple states here. Usually it's 16 months after that initial evaluation. You can ask for a private reevaluation. And then again, when you go to the meeting, when you ask for the reconvene, you can consider bringing an advocate. And as always, you can accept and reject the proposed document piece by piece. You don't have to accept or reject it in its entirety. And then finally, I'm talking to parents, I think unfortunately we often sort of focus on the areas of challenge. So I think again, celebrating the resilience of this amazing population of kids and families, and remembering that, our kids are going to develop differently often if they have really different life experiences than their peers, and not necessarily comparing them against their peers. And, they may not hit those typical milestones. So I always encourage parents to look for the inch stones. And, if your whole family can kind of embrace this idea of inch stones, it actually can really improve everybody's mental health. So an inch stone would be any time of incremental progress, any time when something gets easier, or a time when you or your child can find joy, satisfaction, relief in a setting where you didn't before. So encouraging you to find those inch stones as a family and celebrate them. If you want any more information, you can visit our program website. Again, I'm from Boston Children's Hospital. This is our website. And stay tuned, because in about 6 months, we will have a much better website to link to. So I'm excited for people to see that, and encourage you to follow the Boston Children's Hospital, Benderson Heart Center on social media. If you want to sign up for our newsletter, we have a quarterly newsletter. You can email Jill Modari. Her email is right here. And if anyone happens to be in the region and wants to join our walk team, our Heart Walk team on June 11th, you can email me, and we'd love to have you join. And even if you want to join as a virtual walker, it would be fun to connect, and you might be able to connect to some other parents. So thank you so much. And I'm going to stop my share.
Thank you so very much to Dr. Kasparian, Dr. Sood, and Dr. Ullman-Shade. We have, it looks like, 5 fabulous questions in the Q&A. So if folks are willing to hang on for another couple minutes, it'd be great to get those answered.
Of course we are. I think, Kate, there's a fantastic question for you about, the question is, my daughter, does my daughter need to be diagnosed with anxiety to qualify for a 504 plan, or does CHD qualify her?
Yeah, sure. So that's a really great question. And without knowing the details of your daughter's situation, and please don't tell them to me now, I don't precisely know the answer. Basically, for a 504 plan, a child needs to have a diagnosed disability that is interfering with their capacity to fully access the curriculum. So most kids with CHD qualify for at least a 504, if not an IEP. So I would be surprised if your child did not already qualify. But if you're specifically looking for accommodations or services related to anxiety, you're going to have an easier course if you try to get that diagnosed, because then rather than the qualifying diagnosis being congenital heart disease, it'll be anxiety, and you'll have probably an easier time advocating for services or accommodations specific to anxiety. Hope that answers your question. If not, feel free to email me if you had a slightly different question.
We also have a great question from Laura. Her question is, do you have any statistics about how many kids with CHD tend to have executive functioning challenges?
Does anyone know the exact percentage?
I know there's one study where it said, I think it was 75 to 81%, which is very specific. But that's one that I know I have in a slide that I've presented multiple times. I can look up the exact, but that is show impairment with at least one executive function. And I know that's kids with tetralogy of Fallot or single ventricle. So like a more, relatively more severe heart disease.
And I was just looking at a study that compared to children with CHD to those, healthy children without CHD. And it said, at least in one domain of executive function, it was like 60 some odd percent. So, I think the take home here is that, the rate of, there's different types of executive function. We think about executive function, we're thinking about planning and organization and working memory. And those are not the rates of having difficulties across all those areas, but, even just one type of difficulty, it's a very high rate. And so, I think the gist of it is that executive functioning difficulties are very, very common for children with congenital heart disease, and especially complex forms of CHD. You're going to get different percentages across different studies, but pretty high. And ADHD is a common diagnosis in congenital heart disease, and that's, a diagnosis that sometimes goes hand in hand with executive functioning difficulties, but not always.
Yeah.
This next question comes from someone who is anonymous, but it's such a fantastic question. So they write, my child had her CHD corrected at birth. She's now 8 years old and beyond having annual echoes and a few Holter monitors is generally very healthy. She does have significant anxiety and signs of OCD. Her noticeable anxious symptoms started early in toddlerhood. Have you seen patients with early correction still experience mental health challenges tied to heart care?
Do you want to take that one, Nadine, or start it?
Oh, I'd love to. One of the things that I didn't have a chance to say, but in the story that I presented at the beginning of our time together, Alice's experience early on as a child with CHD really went very, very well. She remembers her pediatric cardiologist as very kind and caring. She describes her family as very loving and supportive. She never really, as a child, experienced any physical complications and didn't ever perceive her heart condition as limiting her childhood or her capacities in life. And yet, she still experienced very significant anxiety. And so, a lot of the research early on has focused on outcomes amongst children and adults with more complex forms of CHD, but there are more and more studies focusing on including children and adults with more mild or moderate forms of CHD. And while experiences of anxiety and depression and traumatic stress may not be as high as those with more complex forms of CHD, they're generally still higher than in the general community. And so, I think all three of us here tonight would say that if you have concerns, irrespective of how complex or severe your child's heart condition is, they're really important to seek support for, and it is possible that those experiences are linked to early heart care. But I'd love to hear what you think as well, Erica and Kate.
No, I agree. I mean, I think it can be hard sometimes for us to totally pinpoint, like, these difficulties are because of this experience, especially when the experience happens so early in childhood. But I think what we can say is that there are certainly higher rates. There are higher rates of all of these challenges in this population. And, did these early experiences contribute? In many cases, yes. it's hard sometimes for us to say for an individual child. But also we know that, you know, kids tend to be more with congenital heart disease. There's just more emotional dysregulation and behavioral dysregulation. Like they just have a harder time kind of like regulating or sort of like getting their emotions and their behaviors more even. And we do know that, and that also can lead to difficulties with anxiety, and mood.
Just having a look through some of the questions.
I think a really sweet question is from Ali here. So she says, as the patient, how can we support our adults and the rest of our family with the stress? And my parents and sibs seem to hide or mask their feelings to not stress the patient, but I think it's harder for them because the other people don't experience the heart problem, which I think is an incredibly empathetic question. And I'm wondering if, as the psychologist, Eric or Nadine want to comment on it.
It's a good question.
I feel like you guys are more qualified to answer it.
I mean, I think it may be that, that the parents and siblings aren't going to speak to the patient about it because that's just conditioned, right? Like we don't want to stress them. We don't want them to feel bad about, but to encourage them to find some other source of support if they don't feel comfortable talking, sharing those feelings with the person who's actually gone through this, but everybody who's been through this experience should have somebody to talk to about it. Yeah. Whether it's a professional counselor, whether it's somebody from, your religious community, whether it's friends, but really sharing those experiences and just normalizing that, like, it's really common to struggle with this. And it doesn't mean that there's anything wrong with you or that you shouldn't feel this way. And sometimes there can be guilt, like, my child survived, or I survived, why do I feel this way? Or I shouldn't feel this way. I should be happy. And so again, just normalizing that, you can feel grateful that you survived or that your child survived, and you can also feel anxious and stressed and, depressed at times. And those two things can go hand in hand.
And I wonder if, Ali, some of what you were saying about talking from the parents' point of view, normalizing, talking about how this is a stressful experience for everyone. I wonder how in this case, Ali could kind of take the lead in her family, if they're not talking about it around her, and say that, like, hey, I'm sure this is stressful for you guys too. And even just acknowledge it and maybe just say it's okay to, it's okay if you want to talk about it.
Right.
Absolutely. And I think there's a comment from Sunrise that really also taps into the importance of community, thinking about linking in with or connecting with groups of people who have genetic conditions in addition to CHD. And I think that is incredibly important. I wish we knew where you were, Sunrise, and please feel free to reach out to us directly if you'd like a little bit more information. But often starting with larger CHD-based organizations like Conquering CHD that have many state-based or local chapters that may be close by can help with building those connections to more specific groups as well.
I know also, so Effie Parks is a rare disease advocate who I think is in California, but I know that she's creating a database of the primary support groups for a whole bunch of rare diseases. And I wonder if she might be someone who could help you. So you could look up Effie Parks. Oh, looks like I can type. Well, yeah. So if you look up Effie Parks, I'm sure you could contact her. She's very friendly and she could probably connect you if they're to support groups. She seems to know all of them.
I'm seeing a couple of questions that I think are we could probably address fairly quickly. The National Online Resources for Young Adult Patients or Families, or young adults to find ongoing support or conversation. I know that ACHA, the Adult Congenital Heart Association, does have, and I see, Sarah, that looks like you're typing an answer, but ACHA does have kind of peer-to-peer support. A lot of the, like, Conquering CHD and Men Little Hearts they now have like a young adult chats or teen chats online that only young adults or teens are invited to. So I think, some of the national organizations that were previously more focused on pediatrics are now expanding to adulthood and later teen years, as well as ACHA, which focuses on adults. And then I see this question about my daughter's counselor is hesitant to diagnose her with generalized anxiety disorder because she doesn't want to have it in her permanent record. She's noted her as having an adjustment disorder, just started solo for anxiety, wondering what your take is. Would her diagnosis then be anxiety due to PTSD from CHD? I think that's a hard question to answer, without obviously knowing your daughter in terms of what the specific diagnosis would be. But I guess I would question, what are the concerns about her having an anxiety disorder diagnosis, if that is what is appropriate. I think I said kind of maybe question or have that conversation with the counselor in terms of what the concern is about that. Because I think, more and more ideally, and I think we're seeing this, that there is less and less stigma with mental health conditions. And I guess I'm not sure what the concern there is, but I do think the most important thing is she getting the treatment that she needs? And so if she's going to be treated in the same way, regardless of whether the label or diagnosis is generalized anxiety disorder versus adjustment disorder with anxiety, then maybe the diagnosis itself doesn't matter. But I do think that it's important to think about what services, would she be getting any additional services if she had one diagnosis or the other? Because sometimes the diagnosis does kind of open the door for different services at school, or maybe potentially even a different path for treatment with the counselor. So it's hard to answer that question, I think, without more information, and that's not really we can't really do that here, but I do think that's just worth having more conversation with the counselor about in terms of what the concern is and if they feel like that really is the right diagnosis.
Such wonderful questions and such meaningful answers and discussion. I'm so grateful for the three participants, Dr. Nadine, Dr. Kate, Dr. Erica. This has been a pure joy to have you a part of this conversation and to learn from you. And to all of you on the webinar, you will receive an email with a wrap up and slides and future resources. So all those notes you've been scratching down, we will send to you in an email. And I know that our presenters would be happy to take more questions too via email, especially through their fantastic programs that they all run. So I thank you all for joining Camp Odayin on our journey to learn and grow as we support our heart heroes and their families. So thank you for joining us tonight and enjoy the beautiful evening.
Thank you.
Thank you. Good night, everyone.
Good night.